Good day, ladies and gentlemen. Welcome to the Manage Your Practice with eClaims and Medexa conference call. I would like to introduce Camille Grenier. Please go ahead.
Thank you, Carl. Hi, everyone. Welcome to our webinar, Manage Your Practice with eClaims and Medexa. My name is Camille, and I'm a marketing manager at TELUS Health for the eClaims service. I'm really happy that you're joining us today to learn more about the eClaims and Medexa integration. So before we get started, I'd just like to go through a few housekeeping items with you to make sure that you can optimize your experience today. So for optimal viewing, I recommend that you hover your mouse over the icon at the top right corner of your screen. So if you do that, you'll be presented with three options. I recommend that you select the side-by-side view, so that way you'll be able to see your speaker's video, but also the presentation. If you have any questions throughout the presentation, you can send them in the Q&A box, and we'll do our best to answer them throughout the presentation. Or if you prefer to wait until the end of the session, you can ask your questions over the phone. We'll tell you how to do that at the end when we start our Q&A session. And last thing I wanted to mention is that this webinar is being recorded, and we'll be sharing the recording by email next week. So without further ado, I'd like to introduce the two other speakers that are with me today. So first, we have Dean Scully, who's an account manager at Medexa. And we also have Michel Charbonneau, who's an account executive at TELUS Health. So Dean and Michel, thank you both for joining us today. So here's what we're going to cover in today's webinar. So we'll start by presenting what eClaims is, and then Medexa, for those of you who are not familiar with either. And then we'll talk about the benefits of this integration before moving on to the live demo to really show you how to use eClaims through Medexa. And then finally, we'll share what the next steps are to set up the integration before we end with a Q&A session. So let's get started because we have a lot to cover today, and I really want to make sure that we have time to answer your questions at the end. So before really talking about eClaims and Medexa, I thought it would be interesting to share a few stats with you that we've gathered after doing a market research with Ipsos Marketing in 2018. So the first stat that you see on the slide states that 4 out of 5 insured Canadians would agree that direct billing will improve their experience when they're visiting a healthcare professional. So whether they're visiting a physiotherapist, a chiropractor, a massage therapist, or any other allied healthcare professional, they agreed that if they offered direct billing, that would make their experience much better. The second stat I wanted to share with you is that half of insured Canadians would consider changing healthcare professionals to benefit from direct billing. And then finally, 3 out of 4 would be more likely to visit or continue visiting a healthcare professional that offers direct billing. So those numbers are great, but what do they tell us? I think what's important to take away from this is that patients really see great value in direct billing, and they really appreciate the service, and it really does make a difference in their choice of healthcare professionals. And before we get started with explaining what eClaims and Medexa and the integration and all of that, I just wanted to mention that throughout this presentation, we'll be using different words to describe patients, clients, consumers, but we're talking about the same group of people, just from different perspectives. So with that in mind, I'll pass the mic to my colleague, Michel Charbonneau, who will talk to us about eClaims.
Thank you, Camille. Thanks, everybody, to be joining this presentation. So one thing I want to begin with is I'll take a moment for people who does not know why TELUS is even involved in all of this. So as everybody probably know, TELUS main business is communication, and TELUS has invested over $3 billion in collateral communication business such as health. So therefore, TELUS Health is a division of TELUS. The eClaims solution to which we're going to be talking today is one of the solutions from TELUS Health. So this specific solution allows for healthcare professionals such as you to direct bill insurer on behalf of your patient, thus letting them pay only the out-of-pocket, not cover in their plan. And we'll go through details today on how that works and who are the insurers that are participating. Basically, to give you a bigger picture, it's just like when you go to the pharmacy or the dentist, the service, you give your prescription to the pharmacist and he gets back to you and tells you you owe out-of-pocket $10, for example. This is exactly the same thing, but for you. Talking about participating insurer, you're seeing them all on screen right now. We're adding insurer every year since this has been launched in 2010, and we are the biggest solution in Canada in terms of private insurance. So we are covering exclusively 85% of all Canadians that have a private insurer, with including the three biggest insurers in Canada, which is Canada Life, Manulife, and Sun Life. For those who do not know Canada Life or it doesn't ring a bell, Canada Life is the new name for Great West Life, just for those who didn't hear that. All right, so how does it work? So at a very high level, and Dean will go into detail on exactly the process, how an eClaim works within Medexa, but at a high level, claims are processed in real time with most of the insurer. And then you can also do predetermination, so verify in advance if the client is covered, and you get paid directly in your bank account through an EFT, electronic funds transfer. So no more having to manage cash or checks anymore. The insurance company pays you directly as a healthcare professional. TELUS never sees the money. It really goes directly from the insurance company to you once the claim has been processed in real time and there's been a confirmation of payment. One thing that for sure it does increase your patient satisfaction and follow-up appointment. That's, as Camille was explaining in the surveys that we've done, goes in the same direction. So obviously, patients that only pay out of pocket or have a better client experience with you, and most likely will refer you, right, to we're in a day and age of social media, so they'll refer you for being having this opportunity to pay less, and now you're eliminating a financial barrier. Which brings me to the second point, is that by eliminating the financial barrier, you're increasing your follow-up appointment. But we're not increasing follow-up appointment just because there's a financial barrier that has been eliminated. You're increasing follow-up appointment because it is needed as a healthcare professional. So a good example that Pascal shared with me is that a client that I would need to see at least twice a week for the next 2 weeks because of, I'll be seasonal, let's say a ski accident, but does not have the financial strength to support 2 appointments for 2 weeks in a row. Now eClaims eliminates that. It puts the health of the patient first. So now a client or patient will go and say, you know what, I will take these 2 appointments and get back to health faster. One of the points that Pascal brought up, Pascal Gagnon, who's the president of the SCPQ and also owner of Banner Clinic of Physiotherapy in Quebec, stated, and I quote, eClaim makes life easier for our client and has a positive effect on their adherence to a treatment plan. And it makes a ton of sense. One advantage, and we've talked about the client advantage, but one of the client advantage for you as a business owner is credit card fee saving. So I'm going to take a few examples. I'm going to give you one example, and I'll give you the opportunity to even try it out yourself. So the concept here is really that if you direct bill before and your client pays out of pocket, even though he pays by credit card, which most of the clients do, pay by credit card, if you direct bill before, while the amount is still the total amount is less to be paid by the credit card, and you as a business owner will pay less of credit card fee since the amount is lower. So that's substantial saving, and I'll give you a good example. So let's say that you you do 20 services per week. Now, I know some of you will say, oh, I'm doing a lot more. Yeah, but let's say that 20 of those of what you're doing are eClaim enabled due to the insurer, and these clients have private insurance, right? And you work 50 week a year. I'll give you 2 weeks vacation here. And you're charging on an average $75. Well, if you're paying 3% of $75 times 50 weeks times 20 transactions a week in credit card fees, if you click on calculate and credit card fees, you're literally paying as a business owner $2,250 based on the example I just gave you. That's just credit card fees, literally money you're throwing out the window when you could be saving and direct billing before. And let's say that you would be direct billing and your client is covered at 90%. And I will assume at 90%, the client will still pay you by credit card. Like, not a lot of people will pay like $8, $10, $11 by credit card, but let's say they do. Well, as a business owner, now you're just paying $225 because 3% of $10 compared to the $75. That's a huge amount of money. So if you're doing even more transaction, that's even more saving. I invite you to go on our website, which you're seeing the link right now. So very simple, telushealth.com/eClaimResources, and enter the number. You don't need to register anything on our website to go and try this out. We don't ask any confidential information or anything like that. Just punch in numbers and go look, and you're going to be surprised of how much money that is. When you register with eClaim and you are put on our search engine. So our search engine is on our TELUS website, but it also is the back search engine of pretty much all the insurer, including the biggest one that I presented to you earlier, so Great-West Life, Sun Life, and Manulife. So let's say that I have a Manulife plan, and I want to know if there is, for example, a chiropractor or a physiotherapist near my home, right? Or a massage therapist, as you're seeing on screen right now. So I would enter just my postal code, and it would pop up all these professionals that direct bill. And that is a free added service that we provide. And I can tell you, if you're wondering how much is that worth, well, this search engine is being used 3,000 times a week. So yeah, very interesting to see people, and people are looking into this, and they are interested, as Kemi presented the survey results, into who is offering direct billing in their area. So with that, I think I need to introduce my colleague, Dean, for a demo of Medexa.
Perfect. Thank you, Michelle. Thank you for everyone for being here today. So Michelle's obviously explained very well what TELUS can do for you. I'm now going to explain what Medexa is, as well as what we can offer you. So Medexa is a completely secure online EMR offering your clinic's metrics and KPIs to help you grow your business. All this is, of course, packaged in a complete management platform. So beyond just revenue management, Medexa's discharge management by clients and by episode of care allows you, as well as your practitioners, to properly complete your treatment plans, maximizing not only your profits, but customer satisfaction, which is, of course, probably your clinic's main goal. These features also allow you to create callback lists and properly manage any patient who might have dropped off, making Medexa a platform that helps your clinic generate more revenue. Medexa also helps you to track all the stats and metrics that really matter in your day-to-day operations. You can easily generate a detailed employee report showing what your practitioners have done in a chosen time frame, as well as how much revenue they have generated. You can also pull up your earnings breakdown, not only for your services, but for items sold as well, So Medexa offers you the ability to track your inventory as well as services offered or performed. We also offer for all third-party payers, of course, including insurers working with eClaims. Medexa generates automatic receivable reports, which helps you to make better business decisions. All right. As Medexa is cloud-based, you can access your platform or Medexa from any device at any time. You're able to generate real-time reports and stats, which allows you to quickly compare your clinic's performance between locations, as well as share data or book appointments in another point of service instantaneously, making remote management incredibly easy. So with everything going on right now, we know you can't be in clinic at all times. Your staff can't be in clinic at all times. Remote management is so important with, unfortunately, our day-to-day situation right now. Our goal, or at least the programmers and everybody's goal when creating Medexa, was to make things as easy to use as possible. Setup with Medexa is a breeze. Depending on your clinic size, getting everything set up can be done within a few hours. With just a few clicks, anyone on your team, and I'm talking anyone, the secretary you've had for 50 years, the new employee, depending on the access rights you assign to them, of course, no matter their tech proficiency can bill, chart, send eClaims, as well as access reports. To help you out, we offer you video guides, as well as a knowledge base, and also live training sessions, which helps you to onboard any new staff member at any time. So if somebody joins you in 2-3 years, they can always come in, join one of the live training sessions, and we take care of it for you, so you don't need to onboard people yourself. We also have an easily contactable and quick to reply support team who are always happy to help out. Like I said, super quick to reply. So, you know, basically in short, Medexa is like having an extra employee walking around. It's like having a clinic manager just walking around, keeping an eye on everybody, making sure everything's in place. All right. We obviously, and I say obviously, you'll understand why I say obviously, sorry, more when you see the product. Worked hard with our colleagues at TELUS to set up an integration that is basically seamless, but we also went a step further when programming. So we work with some of the most influential clinic owners here in Canada to make sure that we can offer you a product that surpasses all of your expectations and make your eClaims, as well as everything else, just as easy as can be. The benefits of the integration, of course, like I said, we worked hard with TELUS to make sure everything is seamless. So we offer you the ability to avoid double entries, quick claim submission. Within 5 to 10 seconds, your claims are in, responded to. It's awesome. We also facilitate payment reconciliation. So when your payments come in, you can quickly apply them via the TELUS portal that we offer you within Medexa. You don't need to go to another website or anything. Everything's just done within Medexa from the TELUS portal. All right, so I'm going to let everybody take a quick look now at what our software looks like. So this is a basic view of the schedule from a clinic. You see here all your practitioners. Right now we're in day mode, so you can see all your practitioners side by side for a quick overview of your day's operations. The main goal here for me is to show you guys how our TELUS integration works. So when you have a client show up or a patient show up, a lot of the times you might want to pre-screen them, make sure they have some space in their insured account. So by clicking on the appointment and clicking on billing, you can take a look at the bill and click on TELUS Actions. So prior to even giving treatment, we can submit a claim. From here, you can select a primary insurer profile as well as a secondary insurer profile. The beauty with this is when creating your patients, you're going to take all of your patient's insurance information and input into the system. So you don't need to do it again in a month or two if the patient comes back. Everything is permanently saved. So I'm going to select my Canada Life insurer profile here. We see all the information provided below. I simply need to accept the terms and conditions. Now I can make this payable to myself. I could also make it payable to the insured member. So if the insured member just wants to pay and, you know, collect the money themselves or the claim themselves, we can do that as well. So I've accepted the terms and conditions. I'm going to confirm and submit this claim. And like I mentioned before, within a few seconds, you should get your adjudication results, as we did here with the explanation of benefits. Now, the insurance percentage on this one is 100%. If that wasn't the case, you could click down here and set up the patient payment, so you could select how they paid you and everything like that. Life is easy. Like I said, everything is done within a couple of seconds. When you receive your payments, so you'll get a notification from your bank or whatever you do to make sure when you get your payment, you can go into the TELUS portal, take a look at your pending payments. Instead of having to go apply it individually to the bill, life is easy. I just need to click here and mark it quickly as paid. So in all honesty, TELUS is such a good system in the first place, you know, very easy to use, but using Medexa just makes it one step easier. As I mentioned when I was talking at the beginning, we also offer full clinic management. So over here on the left, just above the TELUS portal, we have our management tab. We offer you basically every chart, every stat, every KPI you can shake a stick at. You have your revenue report, your appointment report by employee. We have our inventory report. If you have multiple locations, life is good. We click on execute beneath the revenue report. Select from what date to what date I want to generate a report. Okay, let's keep in mind this is a demo account, because if this was my numbers, we'd be closed. So we see here between my 3 service points, all the payments that we received with a global calculation on the top. We offer, as well as all that, your discharge reports. And this is just something we worked so hard with some practitioners from across Canada to create. So each practitioner, as well as clinic admins, have access to the drop-off list. To make things a little bit easier for you, every practitioner can see their own name up here in the top right-hand corner, their profile. They can click on My Tasks. And then, okay, once again, don't judge me. It's a demo account. I have a ton of charting to complete. If we go to the bottom, we see my unbooked patients to follow up with. So each patient is booked by episode of care, and we see here their last appointment. So right now, John Anderson, to me, is an active patient who I haven't discharged. We have a treatment or a plan of care with him that we need to follow up with. So I can come in here, quickly email, call him, do whatever I need to do to follow up with him, or worst case scenario, discharge him without completing care. We don't want to see you doing that, though. This is going to allow you to really keep those patients active and completing their treatment plans. So that's some basic features in a nutshell, but we, of course, offer a ton of other features, including text and email reminders for your patients, fully customizable charting, online booking and integrations with payment and HEG platforms. So you basically have everything in one place. And once again, our TELUS integration is just absolutely seamless, as you guys just saw. So thank you, everybody. Michelle, Camille, I'll let you take it back.
Great, thank you, Dean. I'll just quickly talk about how to start using the integration now that you know more about Medexa and about eClaims. So let me just share those quick steps with you. So first of all, if you're not registered for eClaims yet, you can register on telushealth.com/eClaims. So registration is done online and it's free. So you can do that at the link that's on the screen. If you're not registered for Medexa yet, you can also register on their website. Well, actually, you can go on their website and contact their sales team at medexa.com/en/contact. And then if you're registered for eClaims and Medexa, that's great. Or once you'll be registered for both, all you'll have to do then is set up the integration. So as I mentioned during this call, next week you'll receive an email from us with the link to watch the webinar recording. And in that same email, you'll also find links to the documentation to start using the integration. So all the info that you need to set up the integration will be in there. So look out for that email that we will send next week. I believe there are also demo videos and more in that documentation that we are sending. So you can take a look at that when you receive it next week. So that concludes our presentation. I really want to take some time to answer your questions. We've received a few in the chat, and I'm sure some people will have questions too that they want to ask over the phone. So I just wanted to remind you that you can send your questions in the Q&A box, or you can ask your questions over the phone. I'll let our moderator remind you how you can ask your questions.
Ladies and gentlemen, on the phone, if you'd like to queue up to ask a question at this time, please dial 01 now. And an operator will pull you aside to ask you your name and allow you to ask your question. If ever you wish to withdraw from the queue, dial pound. So again, if you would like to ask a question on the phone, please dial 01 now.
Super, thank you. And while we wait for questions on the phone, I have a few questions in the chat that I received and in the Q&A box. So Dean, Jan, and Michelle, I'll just ask you a few questions if that's okay with you. First one for Michelle about eClaims. People are wondering, do you need to be a TELUS client to use eClaims?
Okay. I will assume that the question is more: do I have to have a phone with TELUS or an internet with TELUS? The answer is absolutely not. No, you don't need to be a TELUS client to be using eClaim. And to add on that, the only thing that you need to participate in eClaim, the only thing that you need is to be in good standing with your respective provincial college, and that's the only thing we verify. So if you are a TELUS client, we're happy and grateful, and thank you. But if you're not, you can still absolutely participate in eClaims.
Great, thank you. In the chat, I have a question for Medexa. We use QuickBooks for all of our accounting and billing. Will Medexa integrate with QuickBooks?
We aren't fully integrated with QuickBooks, but all of our reports can be easily extracted in CSV format and quickly dragged into to QuickBooks or any other accounting software or platform. It just auto-populates the columns, so no integration necessary. It's just a drag and drop. It'll do all the work for you.
Great, thank you. I'm seeing a few questions in the chat about coordination of benefits, if they can be done online. Michelle, can you talk a little bit more about that? Give us more information on coordination of benefits?
Yes, absolutely. Thanks for the question. So coordination of benefits is only available with 2 insurers at the moment, but it is something that is coming along. So please stand by. I know that the insurers that are using it right now is Great-West Life and I think it's Johnson's Group, but please don't hold me against it. But they're the only 2 right now, but we're working with everybody to get coordination of benefit on board. It's a long-term project, and I know that patients are asking for it and healthcare professionals as well. But you have to remember we at TELUS Health and eClaim are working with 23 different insurers. So it is a long-term project for us, but please stand by. It is coming across all the insurers.
Great, thank you. I'm just going to take a moment to see if we have any questions on the phone.
There are no questions on the phone.
Okay, perfect. I'm just looking quickly here if we have more questions. I'm seeing that Jan and Dean are answering questions in the Q&A box, so if you prefer that to ask your question there, that's fine too. We did have another question for eClaims. So what roles are eligible for eClaims?
Oh, that's a very good question. So by heart, let me pull it. There's so many, and we're adding new ones as well. We have chiropractor, physiotherapist, optician, optometrist. We have dietitian, massage therapist, naturopath, PRT, physical rehabilitation therapist, which are only eligible in Quebec. We have podiatrists, only eligible in Quebec. We have chiropodists.
I pulled a list on the screen. If the person who asked that question wants to take a screenshot or remember it, it's all there.
Yes, thank you so much. Yeah, so that's it. Yeah, there's so many of them, right? There's 2 professionals that are not showing there that I'm super happy to share, because I'm the one who works with the colleges to get these professional enable on eClaims, because we want to make sure that we have at least correlation and conversation with the colleges before we enable electronic claims. And remember that for using eClaims or submitting an electronic claim does not forbid you to do paper claims still, right? So we're not eliminating one or it's not one or the other. You can still do both way for each individual client. But what I wanted to state that we're adding 2 new professions that are coming in the Q1, so the first 3 months of 2022, which is not that far away if you think about it. This is occupational therapists and social workers. So they're coming on board as well. So very, very excited to get these guys on board with all the others.
Great. Thanks, Michel. I'm seeing that we're getting a few questions about upcoming insurers. So do you have a list of upcoming insurers you are planning on adding? And then same question for the insurable practices. Well, I guess you just answered that one, but for the insurers.
So for the insurer, if we go back to the slide of the insurers there, so you have to remember one thing before I read. So the response to be transparent is yes, there's more insurer. We're talking with every single insurer that is not on board with TELUS eClaims, right? To have that conversation and get them into a standardized process. That being said, we have to remember that eClaim counts for 85% of all the Canadians that have a private insurer. So meaning that the only thing that's remaining is 15%. Now, that being said, yes, there's 3 new insurers coming on board in 2021, and out of those 3, 2 of those are major insurers in the province of Quebec. So we're very, very excited to launch that soon.
Great, thank you. I'm just going through the questions here, and someone asked how do we get a link to watch this presentation. So just wanted to remind everyone that we will be sending a link to this presentation next week. So if you register, if you're watching right now, you will get a link with the recording link for that one. I just want to see if we have any questions on the phone while I'm going through the questions that we have in the chat and Q&A.
There are no questions on the phone yet. As a reminder, folks, if you'd like to queue up to ask a question on the phone, please dial 01 on your phone's keypad. Okay.
And I'm seeing that we're almost at time, so maybe I'll take 2 more questions, and then if we don't get to your questions, I'm so sorry. I just want to be mindful of everyone's time. We will be looking at all the questions, though, and we will be answering them and include them in that follow-up email that we send. So no worries about that. I'm seeing another question for Medexa. Medexa does not mention opticians, optometrists. Can either of these professions use Medexa for EMR?
Medexa is available to any and all paramedical clinics. As we allow you to send us your charts, we create whatever charting you need to do. So we're available to any and all practitioners. We already actually have some optometrists and people in that domain using us.
Great. I'm actually seeing a lot of questions for optometrists, opticians. So I'll just ask a few if you don't mind. Sorry, I'm having it here. Does Medexa help with OHIP billings for optometrists?
Unfortunately, our billing is complete and it assigns the professional signature, so you'd be able to submit it yourself, but we don't have any OHIP integration.
Okay. Great. I see that we're over time and we have some more questions, but as I said, we will answer all of those questions. You can just write them in the chat if you think of more questions. Also, if you think of more questions after you've received the webinar recording, that's normal. You can always send us an email. You can reply to the email that you will receive, send your questions. I'll make sure that the right team gets them and can answer your questions. But today I want to be mindful of everyone's time, and I see that we're over time. So that's really all for today. So I just wanted to thank you for participating in today's session. I really hope that you found it helpful. Thank you, Michel. Thank you, Dean, for being here with us today. I thought it was a great session, great participation from the audience as well. So thank you for your participation. I just want to invite you to fill out the short survey that's going to pop up on your screen once you close the WebEx window. It's only going to take 1 minute, and it really helps us improve the content that we're creating for you. So we really appreciate your feedback. So as mentioned, we'll send you the recording next week, so you'll be able to rewatch it and then get all the documentation for the integration. So if you have any questions in the meantime, don't hesitate to contact us. So thank you so much, and have a great day.